Hi, I'm Ravin. On behalf of my group, I'll be doing a video presentation on conjunctivitis. Conjunctivitis, also known as pink eye, is a common issue in primary care, affecting all socioeconomic classes and ages. It refers to the inflammation of the conjunctiva, which is a lubricating mucous membrane covering the eyelid. The conjunctiva is exposed and susceptible to many different irritants, allergens, and pathogens, which can lead to varying levels of inflammation, described either as acute or chronic conditions. In order to determine the severity of conjunctivitis and whether the patient requires a referral to an ophthalmologist or specific treatment, knowledge of the multiple causes and symptoms of conjunctivitis must be known clear by health professionals. There are several causes to conjunctivitis. Some of them are bacterial, viral, fungal, parasitical, and personal hygiene plays a big role when it comes to conjunctivitis. Therefore, patients showing severe and prolonged symptoms should be referred to an ophthalmologist for consultation. Some of the symptoms include itchiness, difficulty of opening the eyelids, excessive tearing, and loss of vision. For instance, a lack of itchiness of the eyelid and difficulty opening the eyelids upon wakening are strong indicators of bacterial conjunctivitis, whereas eye itchiness is a common and consistent sign of allergic conjunctivitis. Furthermore, conditions caused by viral infections lead to symptoms including excessive tears and itchiness. There are also some common symptoms of conjunctivitis which include gritty eye sensation, redness, swelling, wateriness, discharge, and discomfort in the eye. In severe cases, symptoms include loss of vision and sensitivity to light. However, conjunctivitis rarely leads to permanent vision loss. The worst possible outcome for conjunctivitis may just be temporary and permanent vision loss, but that is very less likely for patients to suffer such conditions because usually patients seek medical attention within that period of time, within a short period of time. The most expensive evidence-based approach to treating conjunctivitis is definitely antibiotics. Antibiotics are the most effective and expensive ways to treat conjunctivitis. Antibiotics are given in the form of eye drops and should be administered up to 4 times daily. Antibiotics are beneficial in treating conjunctivitis as they control the contagiousness of the disease and an early recovery to the infection, allowing the patients to return to their daily activities. The least expensive evidence-based approach to treating the conjunctivitis would be cleanliness and overall personal hygiene. In our opinion, we would recommend the least expensive treatment. This includes cleaning the infective area and having good hygiene. Proper hand and eyelid hygiene should be maintained to ensure no other bacteria are introduced to the infection, which may also have other harmful effects. The best healthcare professionals to seek when you're suffering from conjunctivitis would be a pharmacist or a general practitioner. Conjunctivitis patients can seek help and support from the pharmacist and available over-the-counter antibiotics such as tropical chloramphenicol that is available for patients 2 years old and above. One of the concerns for over-the-counter drug is that antibiotic resistance is possible to occur that may result in ineffectiveness. Everett claimed that self-care on treating conjunctivitis is possible and most advised, and allows the patient to be independent. On the other hand, if the symptoms do not subside in 3 days using over-the-counter medications, it is suggested to visit a general practitioner to discuss the symptoms and obtain a suitable medication prescription for the patient. In addition, if the symptoms are not settling and there are obvious physical visual complications, further medical assistance is advised, such as to visit an ophthalmologist. Basically, that is the end of our video presentation. Thank you.